Hi everyone, my name is Jess, and today I'm going to be going over with you guys some infectious diseases of the gastrointestinal tract. So I first want to go over our GI tract. So our GI tract, and as you can see in this image here, begins with our esophagus and it ends with our rectum and our anus. So our GI tract is mainly responsible for the uptake of nutrients and water from food so that our bodies are nourished. The esophagus and the stomach are where food passes through and begins to break down. In the small intestine, food is broken down further into its essential elements, so the elements that are needed for cells to be nourished, i.e. carbohydrates, fats, and proteins. Any food that is not absorbed by the body is stored in the large intestine until it is expelled through the rectum and the anus. So the first disease I want to go over with you guys is peptic ulcer disease. I'm going to break these terms down. So peptic is anything that has to do with digestion, and an ulcer is an open wound or sore in or on the body. So in this first image here, we have what a peptic ulcer would look like. There are two types of ulcers, a gastric ulcer or a duodenal ulcer. A gastric ulcer is an ulcer in the lining of our stomach, and a duodenal ulcer is an ulcer in the lining of our duodenum or the beginning part of our small intestine. Now, peptic ulcer disease is caused by this little guy right here. Just kidding, not plankton from SpongeBob, but a bacterium that kind of looks like him, Helicobacter pylori. This is what H. pylori looks like. It is a spiral or a curved rod bacterium that is gram-negative. It has multiple flagella and is very motile, as you can see in the image, multiple flagella at one end of the bacterium. It is microaerophilic and a non-spore-forming bacterium. Microaerophilic means that this bacteria requires oxygen to live. However, if oxygen is in high levels, this bacteria will not survive. This bacteria also thrives in a very acidic environment, so any pH that is greater than 5 is fatal for H. pylori. This is what makes our GI tract a perfect environment for H. pylori, and this is why it lives in the mucosa lining of the stomach and duodenum, because in this environment the pH is about 1.5 to 3.5. Now, peptic ulcer disease is caused by H. pylori digging itself into the mucus lining of our stomach or duodenum. It uses its flagella to bury itself in the mucus lining, and it is able to get to the lining of our stomach or small intestine because of the production of an enzyme called urease. So urease reacts with urea to produce ammonia, which, as we know, is extremely basic. Basic and acidic, neutralizes the acid of the stomach and allows for the bacteria to reach the mucus lining. So as H. pylori continues to proliferate on the lining of the stomach or in the beginning part of the small intestine, it irritates the lining and allows for the acid within the stomach to reach the bottom tissue layer. And so as H. pylori and the acid continuously go up against the lining of the small intestine or the stomach, it irritates the tissue and causes a sore. And obviously it's not on the surface, so it's not something that we can just put a band-aid on. So this constant sloshing of acid and bacteria on the lining makes the sore worse and makes it bigger. Some signs and symptoms of peptic ulcer disease. There are common ones like a burning stomach pain, a feeling of fullness, bloating, or belching, an intolerance for fatty foods, nausea. Some severe signs and symptoms would be vomiting blood, bloody stool, trouble breathing, appetite changes, or unexplainable weight loss. And patients should see a doctor immediately when over-the-counter pain medications or over-the-counter antacids simply don't work, or if they work and then the pain comes back rapidly. To diagnose peptic ulcer disease, a doctor may perform an endoscopy on a patient. So endoscopy is the use of a long tube with a lens at the end to view any possible ulcers. And if an ulcer is viewed, a biopsy may be done if an ulcer is present to detect H. pylori. An endoscopy is usually performed in older patients, in patients who have difficulty eating or swallowing, or in patients that have experienced weight loss. So in this image right here, this is what an endoscopy would look like. A doctor may also choose to perform some lab tests, so either a stool sample or a breathing test. In the breathing test, it involves the patient eating or drinking radioactive carbon. Now, H. pylori actually breaks down carbon into carbon dioxide, and so carbon dioxide would be present in a bag that the patient has blown into, and if H. pylori is present in the GI tract, carbon dioxide would be in the bag. The epidemiology of peptic ulcer disease. The transmission of H. pylori is still largely unknown. It is known that humans and some primates are the reservoirs, and it's also known that H. pylori is found in saliva and in feces. So the most likely cause of infection is through the oral route or the fecal-oral route, mainly due to contaminated food and water. 80% of the population in developing countries are H. pylori positive before the age of 50, and this percentage is significantly decreased in developed countries to about 35% of the population being H. pylori positive. However, 95% of duodenal ulcers and 85% of gastric ulcers are caused by H. pylori. In the United States, about 30 patients per every 100,000 cases have come down with peptic ulcer disease due to H. pylori, and this number has significantly decreased in the past 10 years. The mortality rate is about 1 case per every 100,000 cases. To treat peptic ulcer disease, a doctor can prescribe some antibiotics to kill H. pylori. So these antibiotics include amoxicillin, tetracycline, or Flagyl. Medications can also be given to block acid production. Now, these medications are also known as proton pump inhibitors. They block the part of the cell that produces acid. So we have, as an example here, Prilosec, Prevacid, or Nexium, probably something that you all have seen or heard of. Medications can also be given that reduce acid production, and these medications are also known as histamine H2 blockers. And these medications are mainly responsible to reduce the amount of acid release into the GI tract. Some examples of this would be Zantac or Pepcid. Patients can also go and take over-the-counter antacids, which can neutralize stomach acid and provide rapid pain relief. And lastly, medications can be given that protect the lining of the GI tract. An example of this would be Cytotec. So next I will be moving on to diseases caused by E. coli, and as we know, there has been an E. coli outbreak on lettuce, and so E. coli is not something that can just ever go away for us. So here we have E. coli, and we know E. coli well from our lab lectures. And so Escherichia coli is what the image is here on the right. It is a gram-negative rod bacterium. It has multiple flagella. It is non-spore forming. Some strains produce exotoxins, enterotoxins, or cytotoxins. E. coli is found in our human gut and is part of our natural microbiota, but it is mainly found in the small and large intestine. There are many, many different strains of bacteria, which is why we continuously see E. coli outbreaks in food. So before I get into the diseases, I actually want to get into the different types of cells in the small and large intestine, because these are the cells that E. coli affects. So we first have enterocytes, which are the most numerous, and these cells are responsible for nutrient absorption and production of enzymes that break down the larger molecules. We have goblet cells, which secrete mucus to protect the tissue, and we also have enteroendocrine cells, which secrete various enzymes and hormones. So the first disease I want to go over is gastroenteritis, also known as traveler's disease. I'm going to break down this term again. So gastro having to do with the stomach. Enter is something that has to do with the intestine, mainly the small intestine, and itis, which we know is inflammation. So the disease mechanisms of gastroenteritis is that a pathogenic strain is often found in contaminated food and water, so the most likely cause of infection is through the fecal-oral route. The pathogenic strain of E. coli would adhere to enterocyte cells using adhesins. So the pathogenic strain of E. coli that causes gastroenteritis produces two types of enterotoxins. a heat-labile and heat-stable enterotoxin, LT and ST. So LT stimulates the adenyl-cyclic adenosine monophosphate system. That was a mouthful, but basically what this system does when it's stimulated, it produces an accumulation of fluid within the lumen of the intestine. Now, ST, it mediates cyclic guanosine monophosphate, which basically, if this system is stimulated, it stimulates an extra fluid secretion into the gut, causing dehydration of the tissue in the intestine. Some signs and symptoms of this: if you come down with gastroenteritis, sorry, the toilet is going to become your best friend. Some common signs and symptoms are nausea, vomiting, diarrhea, fatigue, abdominal pain and cramps, and fever or chills. Some severe signs would be signs of dehydration, so dry eyes, crying with no tears. In children, it would be less frequent urination. In patients, they could also have bloody urine or stools or prolonged diarrhea or vomiting. If a child is vomiting for more than 12 hours or has had diarrhea for more than 2 days, they should go see a doctor. And for an adult, if they have been vomiting for more than 12 hours and have had prolonged diarrhea for more than 5 days, they should go see a doctor. Now, to diagnose a patient with gastroenteritis, a detailed history is crucial. So detailed history would be asking where the patient had traveled recently, what they have eaten in the past 24 to 48 hours, and what symptoms they've had, because the symptoms can vary per patient. A stool sample can also be performed to test for the presence of E. coli. So the epidemiology of this disease: it is common worldwide. It is associated with 1.5 to 2.5 million deaths globally. It affects more than 50% of people that travel from developed to developing countries, which is why it is called traveler's diarrhea. So you may have heard, if you are traveling somewhere, you may be cautioned, don't drink the water, don't have beverages with ice, go to well-known restaurants, have your food cooked well, because you do not want to come down with gastroenteritis. It is the second leading cause of death in children younger than 5. And in the United States, gastroenteritis, there's about 350 million cases a year. 48 million of these cases are foodborne cases. To treat gastroenteritis, there is no known antibiotic that specifically targets E. coli that produces the enterotoxins. In less severe cases, this often clears up on its own, so treatment would involve addressing the symptoms. So patients would have to consistently keep themselves hydrated, especially after bouts of diarrhea and vomiting, because the tissues can then be dehydrated. High fiber foods should be avoided until all signs of infection are clear, because you want to avoid massive defecation so that cells have the chance to uptake more nutrients. And also, it is recommended that they take smaller and more frequent meals so that nutrients are uptaked, and whenever someone eats, like, they don't have bouts of diarrhea and all the nutrients are lost. Severe cases should be brought to a doctor or hospital where IV fluids and electrolytes can be given, and the cells can uptake these fluids rapidly. So the last 2 diseases I want to go over are enterocolitis and colitis. I group these together because they both have to do with the latter half of our GI tract. So as I said before, entero has to do with our small intestine, but the term colitis, so itis, as we know, is inflammation, and col would be the colon, so inflammation of the colon or the large intestine. I group these together because the only difference between the two of them is that enterocolitis and colitis, enterocolitis includes the small intestine. Now, enterocolitis and colitis are caused by a pathogenic strain found mainly in contaminated food. This is a repeat pattern. E. coli infections mainly start with contaminated food, so the cause of infection would be the fecal-oral route. So an E. coli colony is established in the intestinal tract, which irritates the tissue and the mucous membrane. And this strain of E. coli is what we call E. coli 0157H7. This is an invasive strain that binds tightly to the cells of the intestinal lining, which causes inflammation and damage. Then this strain also produces a toxin we call Shiga toxin. Now, Shiga toxin is absorbed within the capillaries, which can then bind to the receptors of white blood cells and reach the kidneys, which can lead to a systematic infection that can lead to the death of red blood cells. When this happens, there's a syndrome we call hemolytic uremic syndrome, which can cause kidney failure in patients, which is why it is crucial if you suspect that a patient has enterocolitis or colitis, treatment is begun immediately. Some signs and symptoms of enterocolitis and colitis are diarrhea, nausea and vomiting, fever and chills, and abdominal pain. Some severe signs and symptoms would be bloody diarrhea, pain, bleeding, or mucus-like discharge from the rectum, or symptoms similar of hemolytic uremic syndrome. So these symptoms would be swelling of the extremities, a high blood pressure, and either confusion or seizures. To diagnose enterocolitis or colitis, a stool sample would be taken by a doctor to detect and isolate E. coli or to detect the toxin itself. Also, again, a detailed history is crucial, especially to ask what the patient has consumed in the past 24 to 48 hours. Now, as we know, we have heard about the romaine lettuce outbreak last month, and this is not something that is rare. It's actually something fairly common because enterocolitis and colitis combined causes about 73,000 cases a year in the United States alone. Some of you may remember this, but in 1992, there was an E. coli outbreak from Jack in the Box. It was an outbreak across 4 states. It resulted in over 700 cases due to contaminated ground beef and burgers that were not cooked fully. And it resulted in over 150 hospitalizations and 4 deaths. Here, coming full circle in 2018, as I said before, romaine lettuce, it was an outbreak across 15 states with over 50 cases reported and 19 hospitalizations and no deaths reported. So clearly, E. coli infections do not discriminate age, race, country, wherever E. coli infections happen, everywhere. To treat enterocolitis or colitis, there is no known antibiotic treatment, and in less severe cases, these diseases often clear up on their own after a week. Again, hydration is crucial because after bouts of vomiting and diarrhea, the cells still need to be hydrated. Severe or prolonged cases of enterocolitis or colitis should be brought to hospital attention for immediate IV fluids so that cells can uptake these fluids right away. Nutrients should be replenished with small meals and more frequent meals slowly so that the patient doesn't feel like they need to go to the bathroom or vomit constantly, so that nutrients can still stay within the body. And that's all for me. Thank you for listening, everybody. Happy holidays, and the rest of the slides are just my works cited, so thanks for listening.